Okay, so hello everyone and welcome to our live session today. I do want to apologize for the little bit of tardiness that we may have. There were some issues with our Zoom link for the session today, but we're good now. So I will be going over a quick startup presentation to welcome you all and introduce you to our program and various opportunities if you have, of course, not previously attended one of our shadowing sessions. I do want to highlight that Pre-Health Shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter the demographic status, abilities, or location. My name is Jesus. I am the Chief of Program Planning here at PHS, and I want to thank you all for attending today. Now, let's get started. Just a little PSA, we do have closed captioning for all of our sessions to accommodate all students. This setting is available on the bottom of your Zoom screen, and if you need any assistance enabling the transcript, please direct message one of our team members. We are always looking for ways to be more inclusive and ensure our sessions are accessible to everyone. So please, if you have any recommendations whatsoever for how we can improve, you can definitely email us at info@prehealthshadowing.com. So since this is an international program, we want to know, where are you guys Zooming from today? You are welcome to drop it in the chat. Okay, I see some people. Okay, wonderful. Thank you so much. I see we have people from all over. That is great. I myself am calling in from Puerto Rico in the Caribbean. So if you want to stay in the loop for, you can follow us on social media. We are active on both Instagram and TikTok, or you can also sign up for our email list on our website to never miss a session. And we do have some wonderful opportunities for you all as benefits of being part of our program. So if you're looking to get research experience, I am excited to announce that Pre-Health Shadowing is launching a research program that will allow students to connect with principal investigators as they conduct research in a variety of topics, fields, and locations. This program is 100% remote, which means you have the power to connect with absolutely anyone. More information, you can find it by filling out the interest form that was sent in the chat below, and we will get back to you as soon as possible with any additional details. We have partnered up with Kaplan to get our students a 10% discount that can be used on all Kaplan products, as well as free resources such as study guides to help you prepare for your standardized tests by the MCAT, the NCLEX, or the PCAT. If you fill out our short survey in the chat, we will get you signed up for these deals for free. And I would also like to draw your attention to another amazing program, that is Neolith. Neolith is an online mental health platform for students. For pre-health professionals especially, we know the path isn't easy. So that is why we have partnered with Neolith to spread the word and offer free access to their services if you use the link in the chat or enter the code PREHEALTH when signing up. Additionally, we are really excited to announce that we have partnered with Krispy Kreme for you to purchase one delicious dozen donuts to enjoy with your loved ones. With a donation of $10, you'll be able to receive your treat while also helping us here at PHS. More information and instructions can be found by clicking the link that was sent in the chat. Mask for Mask is another amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, those in the homeless community, healthcare workers without their proper PPE, and others who are struggling to stay safe. With our discount code PHS15, you can get 15% off your order. And if you buy through this method, Pre-Health Shadowing will also get 10% of the proceeds, which is amazing because, as I mentioned earlier, we are a nonprofit that runs solely off the support of our community. If by any chance you want to play a bigger part in supporting PHS, we would love for you to join our network of student volunteers and team members. You can apply to be part of our administrative team and lead students in various projects and initiatives with professional outreach, grant writing, and a lot more. We do understand that as a pre-health student, you may not have the time. So we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would love for you to have, I'm sorry, we would love you to be part of our team and contribute your own perspective. And wonderful news. If you are a high school student and want to get involved with, we have started a program called HTP, or High School Training for PHS, which allows you to connect with college pre-health programs, get involved in fundraising for PHS, and organize free resources for other high school students that are interested in medicine through pre-health shadowing. Here at Here at PHS, we want to recognize the hard work of all of our students in the program. So if you are interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief through the link that was dropped in the chat to have your work on our website. This will definitely look great on CVs, applications, resumes, etc. So do take advantage of it. Part of our mission at PHS is to promote diversity. And in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a series on patient experiences, a COVID-19 roundtable, and international student forum. If you have a mentor, professor, or professional that has inspired you and you think they could contribute to these conversations, please nominate them today using the link in the chat. If you can, we humbly ask that you donate to our program. As you know, pre-health shadowing is completely student run, and we are working around the clock to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, so any contribution you can give would be greatly appreciated. If you're not financially able, we request you send this link to someone you think can, so we can continue to support those who cannot afford similar opportunities. Now, throughout this session today, we encourage you to drop any questions you may have for the speaker in the chat. Our team members will be making note of these to be asked in the latter half of the session, that is the Q&A session. We also want to encourage everyone to take good notes as our professional is going over their presentation, as there will be the chance to take a post-shadowing assessment to verify your virtual shadowing hours. More information will be available on this at the end of the session, so stay tuned, you guys. Lastly, if you can, we request you turn your cameras on. This is, of course, by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer together in a time when social distancing is mandatory. We also request that you make sure to mute yourself, as this will ensure the professional has the complete and full attention from the audience. I appreciate you all for listening once again, and now I would like to welcome a professional. Thank you so much for joining us today.
Thank you for the introduction. So I guess I'll introduce myself and talk a little bit about what I do, and then take it from there. And if anybody has questions, by all means, please ask me the questions. I'm happy to either listen to questions verbally, as we know we're all in like the pandemic world. So like Jesus said, a little bit of face-to-face goes a long way. Right? I'm tired of talking to a computer screen most days, but I appreciate platforms like this. My name is Dr. Prerna Poojary. I am from the Department of Occupational Therapy at the University of Florida. And the department is part of the School of Public Health and Health Professionals. So let me tell you a little bit about myself personally, and then I'll talk about occupational therapy. So I was born and raised in a city on the west coast of India, now called Mumbai. I moved to the United States after I completed my bachelor's in occupational therapy in Mumbai. So for those of you who watched the movie Slumdog Millionaire, I went to the medical school that served that slum. So a lot of my home health experience involved going into the slums and helping people stay maximally engaged and maximally functional. I also had a lot of passion to help the poor and to give back to our community and society. So I started a few projects, and I'll talk about that while I talk about my career pathway. I came to the United States. I had options of picking between the University of Pittsburgh and Southern California, and I picked the University of Pittsburgh. I got my master's in Rehabilitation Sciences and my PhD in Rehabilitation Sciences and Technology from the University of Pittsburgh. I have a total of 5 certifications. So I have a certification in gerontology, and they're all post-professional, so you have to have at least a master's to finish it. A certification in wound care and lymphedema, and certification in oncology management. And each of these certifications have built off of each other. The oncology management certification is relatively unique. There's only 15 therapists in the entire country that have the certification so far. So my practice currently consists of treating individuals who are either in hospice dying or that have chronic multiple comorbidities, leading them to not live very normal functional lives. I love what I do, and I wouldn't trade it for the world. One of the biggest drawbacks of what I do is I get so engrossed in my work that sometimes I tend to ignore my own health. And I wouldn't recommend that to anybody. So put yourselves first always. Make sure that you nourish yourself before you choose to nourish others. All right, that's enough about me. Let's start with talking about the profession of occupational therapy. I always knew that I wanted to help people. And if any of you know me personally, you know I have no problem speaking. Talking is actually a kind of a wicked hobby that I have. I enjoy therapeutically connecting with people and understanding what's going on. So I want you all to reflect at the last time you went to a doctor. Okay, and I know we are from different parts of the world and the country, but think about if you went to urgent care, the emergency room, or even your primary care doctor. What does a typical doctor visit look like, where the doctor is constantly looking at a computer screen and typing, very little eye contact? And I knew I wanted more than that with my patients. I knew I wanted to be able to talk to my patients, connect with them, relate to them, rather than document while my patient was in the room and give them some medication. I knew that health is way past just a pill. I want you to reflect on the last time you had the flu. And how much did your Theraflu or your Tylenol really help you in comparison to the compassion that your family offered, or the good kind words that your friends gave you, or the hot warm chicken soup somebody that you love got you? You know, that went a lot longer in your recovery process compared to the Tylenol or the day flu medication. And you know that the medication had its role, but it was that compassion piece, the outside of the pill component that helped you feel better. So in my own words, occupational therapy is the structured rehabilitation services and therapeutic connections that we connect with the patients outside of that pill. You know, where we tell the patients what to do after taking the pill, before taking the pill, in order to take the pill better and more efficiently. So occupational therapists work from the womb to the tomb. Okay, so basically anybody who, and one of my, this is not a post-professional, but my pre-professional certifications was in childbirth education. So I helped women go through the process of from getting pregnant to the process of child handling and breastfeeding. So it was very empowering for me to see that aspect come to surface, where I was able to connect to women who were pregnant. And then when I went to OT school, I saw a different spectrum that I will talk about. So like I said, womb to tomb. So as a childbirth educator, I used my OT knowledge as well to help with stress management. For all of you who have siblings or a neighbor or a cousin who is pregnant, you may understand, especially if it is the first pregnancy. Pregnancies are not always easy. The doctor will check your blood pressure, and the doctor will make sure that the baby's height and weight is normal, that your weight is within the range. But the stress that goes along with getting pregnant, or even sleeping and positioning yourself with the big belly, and stress associated with eating and nausea, and how to manage all of that, was what I was able to do with my certification. I truly enjoyed that part, because these women, when they went to their OBGYN, all they could talk about was, okay, my blood pressure is normal, the baby is developing fine, but what about me? What about my emotional health? What about my mental health? And that me component is what I brought to the table. And then when I went to start my pediatric business, I owned a pediatric business in India. I lobbied for children with sensory processing disorders. The clinic had 3 patients when I started, and kids with issues with either anger management, or who couldn't write well, or kids who couldn't sit still. So my students know that I'm dyslexic. I have a learning disability, so I cannot spell. So I use Microsoft Word, and thank goodness for spell check. And I don't know left from right. So when Google Maps says go left, I have to see what they mean by left, because I don't know what's what. And most learning disorders come with a lot of anxiety. So when you're anxious, you get more dyslexic, if that makes sense. So I had this inner calling to help children with similar conditions. So I had, in the clinic, it started with one child with autism and a couple of just behavioral issues, children with behavioral issues. And then we moved on to seeing the need in the community and the society. And that's where my role as an occupational therapist, to be a lobbyist for kids that didn't have a voice of their own, started coming through. I enjoyed actually standing up for the children and talking to the teachers and talking to the parents of what the child can do, what the child cannot do. Where exactly do you push this child's abilities? All of that came to fruition and came to life through that business. Within 6 months, the business grew tenfold, and I soon had a waiting list to see patients. And when I came to America, I had to, let go of the business, but I have no regrets about it. I'm very happy that I was able to serve, but I was also able to create awareness in the society, in community, about the rights of these children, about what exactly does it mean when you have a child with autism? What does it entail when you're handling somebody with autism? It is not a curse from God, because there were many superstitions in the community that I was serving. But also there were many myths on what to do and what not to do with a child with autism. So it was very difficult to maneuver and move around all those myths, but it was very rewarding, because they paid off, all the hard work paid off. For those of you who know a little bit about the Indian culture, the bathrooms are not like toilet seats where you can sit down. You have to squat to go to the bathroom completely, right? And there was a child who was incontinent at the age of 11. He had never had a continent bowel movement, because he could tell when he had to go to the bathroom, but he was scared of getting into the bathroom. So multiple doctors and therapists were not able to decipher and figure it out. And I did like a few assessments on this child, and it turned out to be that this baby had what is known as gravitational insecurity. So if I told all of you to stand up on your feet, all of you would be able to stand up just fine without thinking of the pull of the gravity on your body, on your existence and being. But a lot of kids with autism have what is known as gravitational insecurity, where they cannot stand without thinking of the impact of the earth on them. That's why they tend to fall a lot more, or they enjoy, or they have the other end of the spectrum where they do not sense gravity at all. So they enjoy trampolines more for the children that do not have any gravitational insecurity. They like to, I call that the monkey phase, where they are hanging off of their knees upside down and, just scaring the heavens out of me because I'm afraid they're going to fall on their head and crack their skulls open. But this child had gravitational insecurity. He didn't know how to move his body without having an acute anxiety reaction. And all I had to do was, tap into his nervous energy and tell him that I understood him and tell him that he wasn't going to fall or hurt himself. And I did like a little bit of education and training and helped him to squat by holding onto the wall. So he actually learned to crawl like a little Spider-Man on the wall and squat. And he was able to go to the bathroom successfully, clean himself, and then crawl back on the wall for support and stand up. So it was not that he was incontinent. It was not that he wasn't able to, control his bowels and bladder. But it was that he was so insecure. For 11 years of his life, his family couldn't take him out in social situations because he would soil his clothes. So I not only worked with this child, but also worked with the siblings, the parents, the grandparents to help them feel more one as a community, as a family. And that's one of my most favorite things of being an OT. I not only get the honor of working with a patient, but also get to work around the systems with them, because we all belong to families, we all belong to somebody, and, working and meshing in that feeling of belongingness is what I enjoy as an OT. So I had patients there right from, like the gravitational insecurity child. And then I had a child with severe behavioral issues who used to hit himself every time he got angry. So he would make a fist and he would hit his head. And he had like scars on his head from hitting himself. So if he was in America, DCF would have been called multiple times because of how much he was injuring himself. However, we had to try to look at the brighter side and see what was it that he was looking for through the self-harm behavior. And I noticed that whenever he was so frustrated that he could not express what he wanted, is he would hit himself. If he wanted a cookie, but he was a nonverbal autistic child, which means he could not verbalize whatever he needed. So if he wanted a cookie, he would try to say he wanted a cookie, but obviously would not say it clearly enough. And then if somebody didn't understand him, his way of identifying with the situation was causing harm, because then whoever was around him would drop everything and pay attention to him. So it was kind of an attention-seeking behavior, but also to get his own way. So I was able to come up with modifications, A, for him not to hurt himself anymore, but B, also to do behavior modification with the parents and the nanny. To make sure that they didn't reinforce unconsciously those behaviors that caused him harm. And I talked about how to redirect any of that anger or aggression into a more structured way so that this child wasn't causing himself harm. He had a lot of energy. He had so much energy that was difficult to keep up with him in a 45-minute session. So we started, we call those overtly aggressive activities, like taking the bat and hitting a log of wood, or riding the bicycle really fast, or playing in the jungle gym, helped structure a lot of those, that energy that he had. So it was very rewarding to see. He went from banging his head every time he didn't get his way to a sustained structure of, okay, I'm not getting my way, but what am I going to do in order to convey what I want? And helping the parents and him work together towards identifying and meeting his needs. The day I left for America, he continued to be a nonverbal child. He continued to be non-vocal. However, he was able to communicate better. So you don't have to speak words to communicate. And I learned that as being an OT. When I came to the US, I had decided I was going to start my own career in early intervention and see these tiny little babies who really didn't have much support, and I was going to be their support until after my master's, I got asked to work for a research assistant position as somebody that managed data, and they were looking at pressure sore incidents in adults who were seated in wheelchairs. So basically, if you're seated in wheelchairs all day, how susceptible are you to developing a pressure sore? So I started looking at those patients. And little did I know, that was my love there. And I fell in love with geriatrics. I enjoyed the dynamics of communicating with adults. And then I was communicating with the other end of the spectrum. I went from treating pediatrics to treating geriatrics and older adults with dementia and Alzheimer's who didn't have the ability to speak, who didn't have the ability to communicate. So I learned to decipher what they were trying to say. I learned to decipher what they meant and how they wanted to express themselves. So I did seating and positioning and technology assignment for a lot of these adults, but I also did a lot of therapeutic interventions and behavior management for behaviors like wandering, self-inflicting behaviors like throwing the fork at your neighbor across the table because you're mad at the neighbor, you know. So just taking care and and once again, I was working with the patient, but I was also working with the system. I was working with the nurses' aides around the patient, the nurses, the family members. I was working with the CEOs to see how we could structure every unit better so that the patients had more safe avenues to, release these behaviors. I came to the state of Florida from Pennsylvania and started doing home health. So I was seeing a lot of patients in their home. And my wound care experience told me that there was a pressing need to conduct wound evaluations. So started doing wounds and saw that most of my patients had cancer. So I moved on and evolved to running the breast cancer clinic in a city near me. And the clinic once again quadrupled, and I had a waiting list. I was treating breast cancer patients, not only the ones that were having mastectomy with big giant arms, but I also started treating cancer patients in general who had swelling in general. And most of the patients came to me because they wanted to understand the holistic healing component, because the chemo doctors and the radiation doctors, after tens and thousands of dollars, were not able to guide them about, okay, you have a radiation related burn, or okay, I'm having so many side effects from the chemo. What can I do? And that's where, as an OT, I came in. Currently, my practice involves the rehab department. So I basically go to the rehab wing. I see patients with a stroke, with brain injuries, with amputations. Saw a lot of COVID recovery patients, multiple organ transplant patients. So saw patients with liver transplantations, with kidney transplantations, heart and lung surgeries, and helping them recover. Because my rule of thumb, and it works most times, is that for every day that a patient spends in the hospital bed without moving, they need about 3 to 4 days of rehabilitation, of exercise, of conditioning in order to move back to their normal life. So think about the last time you had the flu and you just laid in bed there, or, forget flu, we're all grown adults. Think about the last time you partied too hard and had way too much alcohol, right? Think about the next morning. Was it easy to wake up? And that was just like a few hours of partying. And then the next morning, your body pays the price. So all these patients that we get to see have spent hours and hours and days in a hospital bed. They can't even get up to go to the bathroom. And then they come to rehab because they need the exercises, they need the structure, they need the modifications to make their environment stronger so that they can function optimally. One of the biggest myths I get is, you're an occupational therapist, but I don't need a job. And within the term of occupational therapy, it's not that I'm providing you a job. It is the fact that I will help you enable yourself get back to the occupation that means the most to you, to the occupation that makes the most sense to you. And I try my hardest to help the patients understand that I'm not there to provide them with a job. I'm there to support them, to help structure their environment. So now I see a lot of my patients go home and are fine and are back to their normal life. But a lot of times I see patients who are dying, who don't make it. And I'm standing there with them, by their side, with their family members, while they cross that bridge, while that decision is made. And it is incredibly difficult. And I've learned to have that therapeutic relationship with them, so that I'm not preparing them to die. I'm just adding value and life to the days that they have. I'm not telling them to count how many breaths they have. I'm helping them add life to every breath that they take. Like one of my favorite stories was my 49-year-old patient who had vaginal cancer, and she had cancer for 16 years. So she developed the cancer when she delivered her youngest baby. And I remember helping her and talking with her through the process of, we knew she was going to die. We knew she didn't even have like 6 months. But I remember telling her, so what? Go on date nights, have those difficult conversations with your kids, tell your daughters and your son what you want them to be when they grow up. Tell them what you envision their wedding to be, and just helping her through that emotional mental process. But she also had very complex wounds. So within my specialty, I was able to take care of her wounds. But I was not that therapist that just sat there and cared for her wounds and wrapped her wounds. I was able to make that therapeutic connection. So she had a better mesh of a network. So she had more of a support system. So I encourage you, I don't know if you will choose to be an OT. I don't know what you will choose to be, but whatever you choose to be, don't do it for the money. Do it because it is your opportunity to give back to the world. As a relatively mature adult, I will say, life gives us very, very few opportunities to return favors to the community and the world we live in. And we should make the best of every of those opportunities. I will talk a little bit about the interdisciplinary collaboration. As an occupational therapist, I've also enjoyed my heart content talking to other professionals about my patients. So I will talk to the cardiologist, to the nephrologist, to the neurologist, to the oncologist, to the PT, to the physical therapist, the speech therapist. I will talk to them all about how my patient is doing. What's going on in my patient's life? How can I help my patient? What can we do as a team? And I try to be that cohesive team member, gluing every component of the patient care together, so that all that matters is what the patient wants, not what we want for the patient, not what insurance wants for the patients. And you will realize that as a healthcare professional, irrespective of what you do, you will learn to maneuver and meander around insurance, but you'll also learn that it is at the end of the day about the patient, not so much about how much money that patient's insurance brings. Okay, I know I had a lot of time to speak, and I can speak about OT all day. But if any of you have any questions, I would appreciate if you ask me those questions, so we have more of a dialogue and we can talk more in an open fashion. And if the organizers have comments or leading thoughts that you want me to elaborate on, I would be more than happy to.
Yeah, I do have a quick question over here. So what made you decide to pursue your further education and career in the US after you accomplished your bachelor's degree in India?
Thank you for that. So I was very passionate about getting a PhD to do research. And a PhD in research wasn't an option in India. And I knew that I had to come to outside of India in order to pursue that dream. Hence, to get my PhD, I moved outside the country.
Okay, great. Thank you so much. That's wonderful.
Thank you.
Do any of our audience members have any further questions?
Yeah, I actually do have a question. So it's kind of like a follow-up of what you just answered. So speaking about research, are you currently in any research, and like what kind of just made you interested in that field of research?
Yes, thank you, Susan. That's a great question. So I have my own lab here at the university, and I basically, in my lab, so the lab is not a structure, it's the people. In my lab, I look at teaching pedagogy, I look at healthcare disparities. So I write with students. So a lot of my undergraduate students say, Dr. Poojary, I need like a research topic to write about so I can make my, my application stronger. I said, okay, let's write. And we do literature search, we do systematic reviews, we'll do case studies on topics that interest students. So I can give you a few examples. Right now, I'm writing, like a few of my favorite topics are the COVID crisis in the homeless population. So how has COVID disparately affected and impacted the homeless population, but also how have we as a society, pardon the terms, but failed to serve the homeless population in the midst of the pandemic. Okay, so think about each of us. We had a safe place to be at home during the pandemic. The homeless people, the streets were their home. So they got COVID a lot earlier than any of us could have been exposed to, but they got healthcare last compared to anybody that was exposed to it. Then another topic that we're writing on is facial cosmesis. So basically cosmetically visible disparities. So anybody with cosmetically visible issues having to work harder to cope compared to non-visible cosmetic issues, and how it differs by age and race and socioeconomic status and opportunity. I'll give you an example. So suppose, say, somebody from a low socioeconomic class has like a scar on their face. What does that person have in options compared to somebody who's rich and living in a $10 million mansion who can go to a plastic surgeon and get multiple grafts do. So we are writing, those are the two topics we're writing on. I have like 11 topics so far. But there are various, you know, it's a very student-led lab. And then I have funded research through the chair of my department, Dr. Sherilyn Clausen, where we look at driving behaviors in combat veterans. So basically, motor vehicular accidents are the second leading cause of death in veterans in America after suicide, because the combat veterans perceive passerby vehicles as war zone weapons and tools. So they have a lot more road aggression, they have a lot more speeding tickets, they have a lot more at-fault accidents because of that perception. And what we are doing is helping them identify those behaviors so that they can fix them, correct them, and be better. So that's the funded research. And then I have my own self-run lab. I do see a question in the chat box, Susan, I can take that. How do you feel like your knowledge in OT helps in your research? Also, what's the most challenging part about your day-to-day job? Thank you for that question, Alana. So I'll take the first part. So I believe as an occupational therapist, I think very holistically, right? So I'm not thinking just from a tunnel vision, what am I going to do? What does my patient want? It's a very client-centered approach. So the client-centeredness of my approach helps my research become all about the client, helps the research become about how can we help our clients better? What can we do to help our people better? That's what it helps with. And the most challenging part about my day-to-day job, actually, that's very interesting. It's difficult to leave my stories at work. It's difficult to not take a lot of the burdens home. You know, when COVID hit and everybody was planning mini vacations at home, we were double and triple masking in the hospital, helping people. You know, it was difficult to see people die. It was difficult to see all these complications that were not researched and not known come to surface. Like, it was difficult to see people getting a stroke because of COVID, aneurysms erupting because of COVID. You know, there's a lot of unknown in the world of medicine, and it's difficult to leave that at work. But I will piggyback that off of, it is the most gratifying experience when your patient meets their goal. My favorite part in the hospital is their ambulance bay. 99.9% of my patients come in a stretcher, asleep or unconscious in the rehab wing. And I would say 75 to 80% of those will walk out of that same bay while their family members are waiting in the car for them. And those who don't walk out wheel themselves in a wheelchair. But in that same way where they came unconscious and in a stretcher, they're walking or wheeling themselves out. So as much as it is hard to not take everything, not leave everything in the hospital, it is gratifying for me from a clinical perspective to see those goals accomplished. And when it comes to academia, I love my students. I love launching these souls into the world and seeing them do great things. My classes right now entail me helping OTs, PTs, speech therapists, nurses, doctors, so all my students move on to be better, greater versions of themselves. There are a couple more questions and I'm going to read them one at a time. If you have any children, what advice do you have about managing personal and professional life? Well, I have children by heart. My kids are born out of my heart, and I have 4 babies. So right now, managing personal and professional boundaries, the best advice I can give you is you cannot pour out of a glass that is half empty. You have to take care of yourself, give yourself, nourish yourself, make sure that you are healthy and fulfilled enough before you give others. And I'm part of a profession where I give others at work and I give others at home too. So I have to make sure that I have time to go to the gym. I'm taking my vitamins. I'm doing my meditation and my yoga, because without that, I will fall apart and then I can't do anything of what I am doing with others. So yes, when it comes to kids learn by example. You use one foul language in front of them and they will repeat it for at least 3 months before they're put in timeout for using them, right? But when you show them that you're taking care of yourself, you are studying, you are doing the work in order to work and be better. When you show them that, they learn. And that's the advice I'll give you. You teach them that you cannot be professionally better if you're not personally good. And you cannot be personally good if you're not professionally good. At the end of the day, when we lay our heads on our pillows, you have to think of, did I do my best in all dimensions and domains of my life? And if the answer is yes, you will get a good night's rest. So maintaining those boundaries, but also allowing that boundaries to marry each other so that your kids know. Do you work independently in this field or do you work with a team? Currently, I work as part of the UF Rehab Hospital Society. So basically, I work within the University of Florida, the Department of Rehab. And then my appointment as a clinical professor is in the Department of Occupational Therapy. I did have my own business in the past. And just life dynamics didn't allow me to continue the business, even though the businesses are flourishing. It's taken over by other people. There's a few thank yous. You're welcome. I'm glad I'm able to be helpful there. In pediatrics, what approach has worked best for you in encouraging a child to receive treatment they were anxious about? That's actually a good question. Anxiety comes from the unknown. Okay, so if I told all of you to close your eyes and I put you by a cliff, the unknown will give you anxiety, right? And hopefully I won't push you off, right? You will not know if I'm going to push you, if I'm going to put a net below you when you fall. So making sure that not just the child, in general, the patient, the adult patient, the old patient, the young patient knows what to expect, knows what is the best and worst case scenario. One of my life mottos is be prepared for the worst and hope for the best. So helping your patient, hope for the best, but also be prepared for the worst. What's the worst case scenario? You will roll out of here in a wheelchair, but you will do it. Nobody will have to do it for you. Okay, what's the best case scenario? We will put some support systems in your leg and you may be able to walk. That's your best case scenario, but you are going to do everything. No one's going to do it for you. So showing them what to expect out of the recovery. So there's no surprises. And it's the same with children, helping those parents understand. Think about it, right? If you have nieces and nephews, wouldn't you want to know what your doctor is doing with your niece and nephew compared to, oh, we're just going to let it play out and figure things out on their own? It's difficult. Let me see. Are there any jobs that you think you would like if you couldn't do OT? I like that question. So I originally started off wanting to be a pilot. I came from a very poor family, and they couldn't afford flying school for me. So guess what? I am in flying school now. I do flying as a hobby. I have my commercial pilot student license, and I fly as a hobby. And I have no remorse about it. But you live life once. You have one opportunity to accomplish your dreams. I'm not going to ever fly a big United Airline airplane, but I fly my own little 4-seater plane, and I'm able to, it's a surprise for my parents. So when they come, I'm going to make them fly in a plane. They were happy and ecstatic that I could drive a car, and now I am going to fly a plane with them. So it's amazing. But I also wanted to be a gynecologist and a surgeon. And, you know, going back to coming from a poor family, I didn't get the scholarship to go to MD school. But I got a scholarship to go to OT school, and then I became the certified childbirth educator. So you make the best of all opportunities life gives you. So honestly, if I couldn't do OT, it would definitely have to be something in healthcare. I would have to be like some form of administrator to help improve quality of healthcare services provided and all of that. Yeah, so it definitely have to be in healthcare. What health disparities is often present in your line of work? That is opening such a big can of worms. It's a lot of healthcare disparities, I will tell you. They're infuriating healthcare disparities, and most of the healthcare disparities that exist are because of implicit biases, because of biases that people have but are not aware that they have them, right? I'll give you an example. There's, I don't know the exact numbers, but there's an astonishing difference in offering of chemotherapy and radiation treatment to women with breast cancer who are not Caucasian. So if you're not Caucasian, if you're not white, you're not offered breast cancer radiation and chemotherapy treatment compared to if you are Caucasian. Body languages of clinical providers for people who are not Caucasian is a lot worse than people who are Caucasian. I am one of the faculty liaisons and the founders for various wings of what we call as the Equal Access Clinic in the University of Florida. So it's a student-run clinic. It's a faculty facilitated clinic, but it helps people who are underinsured or uninsured. We do not charge them a dime. And they can get everything from dental services, medical services, medications, rehab services. And during the COVID pandemic, we started our own tele-rehab wing. So basically they got all rehab services for free. All they needed was having a tablet or a computer or a phone or a device that they could look at us through. And if they didn't, we were sending them things in the mail, handouts in the mail that they could look at, and we could walk through the rehab process with them. So healthcare disparities exist everywhere, but there is somebody in all those situations who make that difference, who bridge those gaps. How were your academic or fieldwork experiences in grad school? Well, so I'll explain India versus America, right? So in India, I told you it was the slumdog millionaire slums that I went to and served kids, adults, older people, all of that. So that was very humbling to see people not have, let me see, 2 cents to buy a Tylenol, okay, while I was spending $1 on a meal. That's very, it brings a lot of perspective to life, right? It talks about how much people don't have. When I came to America, I did my fieldwork in a skilled nursing facility and in outpatient care. And it was very humbling to see how disabling conditions are and to see the impact that my clinical skills made in the lives of these individuals. You know, to know that I was getting into a field where I could truly be that agent of change. I could be the hope where there was no hope. So it was very, very groundbreaking and astonishing. I would, for all of you who are in any kind of fieldwork or, you know, seeing patients now, just expect the unexpected is what I will say. it is so difficult to have a formula of this is what I'm going to see today in the hem-onc unit in the children's hospital. It's close to impossible to define what you're going to see in these situations. You know, what matters is that you are constantly refining and renewing yourself as a person in order to be a better professional and a better clinician. That makes sense?
It definitely does. Thank you so much. Everything that you're saying, your answers are so inspiring.
Thank you. That's what my name means, inspiration.
That is so cool. What a coincidence, honestly.
And Jesus, I'm going to be in Puerto Rico next Thursday.
Really? I
Yes.
really hope you like it here. It's really nice.
I am
It's a
very
calm
excited.
environment.
I'm coming for a friend's wedding and I'm actually going zip lining and we're doing like a whole bunch of things. I told them the wedding is the least important part of my trip.
I'm so happy. I'm so happy, honestly. And I do hope you get the chance to visit like our beaches. They're wonderful.
Yes, we have, the wedding is on the beach. So I am very excited.
Great, great. So I do have a question, and I do love that you're working so hard to minimize disparities in our healthcare system, right? And I wanted to ask you, do you think other healthcare professionals, other healthcare professions in general, how do you think they might change in the future regarding those disparities?
So I think disparities are a systemic issue. They don't exist at individual level. They exist because more than one person and a system fails. And I feel the only agent and way of changing that is at an individual level, because what makes a system is multiple individuals. And I'm doing my due diligence of moving forward with the world of creating awareness of these disparities. For example, even talking to my students about bedside manner, about telling them the importance of maybe your eye contact with this patient is going to be all the eye contact they get all day long because they go home into an apartment living by themselves. So you do your due diligence of making eye contact, telling the patient that they're loved, that they're cared for, instead of doing your notes and documenting. I understand that documentation is the bane of all clinicians' existence. However, you have to be able to, do what you're doing for the greater good, because it is about, like I tell my students, if you want your big paycheck, go be the CEO of a firm. You can easily become, you can get into investment banking. It's a great way of making money, but you're doing this because of the soft skills, because of, the help that you give people, because your results are truly visibly tangible. So whenever you see disparities, and I will encourage each of you in this room, you will be subject to some form of disparities at a point in your career. Sometimes you will be subjected, as in you'll be the victim, and sometimes you may be the one that is part of the disparity. Does that mean you're a bad person? It doesn't. It just means that you need more awareness, you need more training, you need more understanding so that you can move past it. Think about the disparities in our minds that we have of nurse practitioners versus doctors, even though their roles are very similar. So just creating that education and that awareness amongst yourself to move past it, making that difference at an individual level so that the system and the society around you is better. Choose organizations to work in that support growth rather than stunt your growth. Choose organizations that allow you to be your own person, not make you the person they want you to be. It has to be a symbiotic relationship, not a parasitic relationship. Okay, I have like one private message and then one more question. So we can keep going with the questions. I appreciate it. What advice do you give an international student who's planning to go to med school in the US? I think that's a great question, and it's a loaded one. my biggest struggle coming from India to the US was understanding the differences in the culture. Culturally, our expectations are different, availability of resources and help is different, verbiage of talking about disorders and conditions is very different in the US compared to India or any other country. And I have the honor of working with various international students. So I see that the way we express ourselves, the way international students put thought together is different. So understanding the context of the country you're going to, it doesn't have to be the US, but any country, understanding how to present the information and interpret information in the most appropriate way, so that you're understanding exam questions, so that you're understanding what you're getting into from a treatment perspective. Like something to consider for those of you who are international and thinking of coming to the US. Do you seriously want to deal with insurance system and proving to an entity that your services are worth it? Or do you want to go to a more government run organization like Canada, where services are more easily available and provided a lot more easily compared to insurance-based systems. So these are questions that you need to, run around and ask yourself. Do you have any tips for building relationships with patients and having good bedside manner? Absolutely. My biggest, and I tell all of my patients this, I treat my patients as if they were my family. I won't even say I treat my patients as if I would want to be treated, because I settle a lot of times in life. But when it comes to family and people that I love, I will not take anything other than superior things for, what it's worth, for face value. So treat your patients like their family. Make sure you make eye contact. If you don't know the answer, it's okay to say, I don't know. I can get back to you on this. Make sure you have that courage to say, you know what, Susan, I don't know the answer to this. I'm going to just read, I'll ask my colleagues, and I'll come back with a response. The power in being vulnerable to your patients is astonishing. Your patients have so much more respect. A lot of clinicians think, I'm going to bluff it. I'm going to fake it till I make it, and my patients will like me for it. And patients know when you're faking it. Patients have more respect when you say, I'm going to follow up with you, Jesus. I don't know the answer to this. And you will realize that your patients have so much more respect, and whatever you follow up with them will stay in their brain for a lot longer, because they know you took the effort. You invested in time in them, something that they may not have had in the past. And tips for building relationships with patients. I think for any relationships, drawing boundaries is important. So don't give yourself so much that you lose yourself. Make sure that your relationship with your patients is edifying, but also make sure that your patient is comfortable to ask you questions. Be a good listener. Allow your patients to finish their sentences. You have no idea how many times I want to, this is off the record, okay? I didn't say this, I'm just saying, kick people in the face when they don't let their patients complete their sentences. I'm like, what are you thinking, dude? Your patient needs to finish their thought. And it's just really frustrating. Be a good listener, because therapeutic listening is powerful. Your ears are what the patient may have all day long. They may not have anybody else to talk to. I have patients who live with pets. That's it. That's their life. They don't have any family members. Your interaction with them is all they have. So be a good listener and treat your patients as if they are family. And draw good boundaries, healthy boundaries. So somebody said, do you think America is safe for WOC? I don't know what WOC is, if that's work related, even just to attend med school. I think, I personally, women of color, okay, thank you, sorry. I personally think safety doesn't come from a geographic location. I think safety comes from a mindset. I create that environment for me. If I create an environment where people can stamp all over me, people will. People know better. Trust me, people know better than to mess with Prerna. And I'm not saying I'm mean and nasty. I have those boundaries drawn. I have, no, you cannot talk to me like this. You cannot get away with talking to me like this. So thank you for clarifying the women of color. But I think for any individual with color, we draw our boundaries and we set the precedents, because I used to like to believe I'm a feminist, but I think I'm a generalist that likes to stand for human rights, right? Just because I'm a woman of color doesn't mean I'm more important than a man of color. I think everybody is important for what they're worth, not because of their color, not because of their country of origin, not because of their religion, because of what they are and who they are. Doesn't mean that people of color. I teach a class, it's called Critical Issues in Public Health. I call that my Democrat Republican class. And it's a very interesting class because I talk about the Democrat and the Republican view of topics like abortion, So try talking about abortion without talking politics, and it's almost impossible. And one of the things I tell my students is it's not about whose rights you're discussing. It's about what is right. You cannot tell anybody that this is a rule, especially when it comes to their body. At the same time, you cannot take away their authority. So we go on and on. It's a 15-week class. We talk about things like medical marijuana. We talk about prisoners. We talk about immigration. We talk about like a lot of things. And one of the stances I take is, irrespective of your genetic composition that makes our features, our origin and our caste and our religion, okay, your true self-worth is in what you are, not how you are, in what you are. What are you at the end of the day? So if you took away Prerna's color, Prerna's identity as originally from India, Prerna's PhD, if you took away all of those layers, what is Prerna at the end of the day? Not how is she. So I believe that America allows me to be the what. India allowed me to be the what, and I have immense respect for my country. I go back every year, and every year I speak, and I consider it an honor. I have more than one place to call home. So I hope I answered the question. But no matter what part of the world you go to, as a woman of color, as somebody who has various layers that identify you differently than the society you belong in, think of not how you present yourself, of what you bring to the table. And what boundaries are you drawing to make that identity more visible, to make your self-worth more to the surface? What are the boundaries that you're drawing?
Thank you so much once again.
You're welcome.
Okay, so we do have one question over here that I think it's actually very, very interesting. So what do you tell parents? This one is regarding the OT position, right? So what do you tell parents when they find out that their newborn might have mental or behavioral disorder? And like, how should they raise in the future the child?
It's a difficult conversation to have. I've had to tell a mother that her child was blind. And that she didn't respond the way I expected her to. And the fact that I had expectations for her response was ridiculous right there, right? I was telling a mother that her child would never see for the rest of his life. He only had light perception. So he kept looking at the TV, but he couldn't see his toys. He didn't know where his mom was. So I think, presenting the facts physiologically. So if I could do that any differently, I would talk about how the child's optic nerve wasn't well developed. So it wasn't sending messages to the brain. Hence, he couldn't see. Hence, all he could see was light. He could see where the window was. He could see where the TV is, but he couldn't see anything beyond that. So talking about like the physiological basis and tying it to a functional impairment, saying, okay, suppose we're talking about, an intellectual disability where the child's IQ is going to be relatively lower than the rest of the children, right? Just helping the parent understand, look, your child's brain didn't develop in this trimester, and it is not your fault or the child's fault, or it's not a curse. Even in America, and even today, we get to see so many people who think sicknesses are a curse from God. And it's a very interesting paradigm. But helping tie structure to function has always helped me get the most appropriate response. And sometimes people will scream. I've had people to tell patients that their cancer is back. It metastasized from the breast to the brain. I've had to make that decision and talk to them about it. But, allowing them the opportunity to scream, to cry, to tell you that they don't like you and they'll go get another opinion. It's all within their rights to respond a certain way. And I feel more than expecting a response from them, prepare yourself for the worst response. And then if they are crying or if they're upset, just ask how much can you comfort them. Sometimes I have patients who say, give me 10 minutes. I need to really, mourn about this, and then I'm going to be ready for more therapy. And I respect that space.
Thank you. That's wonderful. I love your perspective on that.
Thanks, Jesus.
So you did mention that safety comes from what you create, like from the environment you create, right? And confidence and everything. So, but I want to ask you, did you ever face any doubts or not have support from your family or friends while on your path?
Oh, lots of times. Lots of times. Most of my dreams were because I was stubborn and because I believed in myself. And I'm very grateful that I have a family that supported me eventually over time. But there were many hiccups. There were many hurdles. There were many hindrances. But the one thing that didn't go away was my belief in myself. I have a partner today that's very supportive, that's very understanding of me. He puts up with so much of my garbage. He needs a Nobel Prize for just putting up with me. But it's, your support system is reflective of what you are, of what you expect of them. And when your support system doesn't give that to you, you have to become stronger so that your support system sees it, right? I won't disclose, so politics and I don't get along because I think they're very extreme. But to me, Kamala Harris becoming the vice president was monumental because, after how many years of existence of America did we have a woman who is a leader, right? So I canceled all my meetings on Inauguration Day when I knew she was going to take her oath. And when she was taking her oath, I heard every single voice that told me coming to America was a mistake. I heard every single voice that told me doing a PhD was a mistake. I heard those voices and I heard my feet stomping upon those voices because I did it. I came to America. I came to America with 2 bags, one with food, half a bag of clothes and half with books. 2 bags, 5 $100 bills. I slept on the floor of a living room on a mattress because I couldn't afford rent in a bedroom. And I made it. Did I create fear in my support system? Heck yeah. If I were a parent, I wouldn't want my child to go live in a living room on the floor. My parents were scared to pieces. I didn't have a phone that I could call them on, Susan, don't cry. I made it. Look at where I am. My dogs lay in Sorta beds now, let alone the kids and me, and us. I think expecting people to support you is not as realistic as expecting yourself to be strong enough to create that support system. Don't expect people to support your dreams. Let your dreams be strong enough that people will want to support them. And if people are not supporting them temporarily, they will in the future. That will happen, Show them you can study, show them. I looked at a cutout from a newspaper in India that said, one day I will have those letters in front of my name, DR. And I looked at that for a decade. That's how I got into, and it was devastating when I didn't have the scores and my parents didn't have money to send me to med school. It was devastating, it was crushing. All my life, I wanted to go to med school, but then I became an OT. I'm here today. I'm impacting equal lives, if not more, as an OT, So, The universe always gives you as much as you can handle. And I will tell you, your support system is reflective of your dreams. And don't expect, you create that support.
I love that. And not only did you become an OT, you did end up getting those letters DR in your
Yes.
name, which is wonderful. And I'm so happy for that.
Thank you.
So I think this is going to be our last question. And you did mention, and I think your story it's very, very inspiring. And how do you need to be stronger to demonstrate that you can reach your goals. But was there ever a role model in your life that sort of help you lead that mindset of yours?
Absolutely. Quite a few role models. Once again, when it comes to role models, you won't have one perfect one. So for me, I had many heroes. Okay. My father is a high school dropout. My father did not have the opportunity to go to school, to finish schooling. My father is my hero. He taught me what most syllabi in colleges don't teach me. He believed in me when most people did not. Then my mother, who taught me to live by my faith, who really helped me become true to my name. My grandmother, who taught me what to expect from the world and how to stand up in my relationships, who made me strong enough that I could walk away from an abusive marriage. I was able to do it because of the confidence she instilled in me. And my last hero is the man in my life right now. And he puts up with me a lot. And he believes in me on days where I'm like, honey, I can't do this. This manuscript's garbage. And he says, no, you can. And this is beneath your intellect. You're tired, go take a break. And you got this. So I am very, very blessed.
Thank you. I'm gonna share my screen real quick over here, but I want to thank you so much, Dr. Poojary, because it's really been inspiring listening to you today. And I think, it helped us, at least to help me, open my perspective to other things and, be aware of many things that we have to work towards, as future healthcare professionals. And I don't know, it was just really, really great listening to you today and attending this live session.
Thank you, Jesus. And as a healthcare professional, just remember, it's always about your patient. And when you see your patient do better, when you see their families do better, most of my patients die because of the population I treat. But I help those families. And when you see that light in their eyes, it makes it all worth it. So never forget why you are becoming a healthcare professional. Some of you may become neuro-onco-surgeons, some of you may become nurses, some of you may become OTs like me, whatever you choose to be. Don't forget why you're choosing to be it. And if you ever need a pep talk, I'm on Facebook, Instagram, LinkedIn, everywhere. Just get a hold of me and I'll be more than glad.
Thank you. Thank you once again so much, Dr. Poojary, for that wonderful presentation talk of yours. It was really, really inspiring. And I think we all learned a lot of wonderful things from you. So considering this, I did want to invite you all to reflect on the session today, on these 3 questions that we have on screen, right? What brought you to this session today? What are 3 major takeaways you got from it? I know there's a lot more than 3, but just name 3. And what do you want to learn more about? I invite you all, just to maybe answer these questions on paper. And if you do write these questions and answers, even though it is not required, I encourage you to submit it to our website for publication and recognition of your hard work and to enhance your future applications here at PHS. I would also like to mention once again that Pre-Health Shadowing is launching a research program that will allow students to connect with principal investigators as they conduct research in a plethora of topics fields, and locations. Once again, this program is 100% remote, which means you have the power to connect with absolutely anyone you want. For more information, you can fill out the interest form that was sent in the chat, and we will get back to you as soon as possible with any additional details. If you want to learn more about pre-health shadowing and how to get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, and social media promotion as well. And we are also accepting team member applications if you want to take on a more active role in PHS to lead projects and initiatives to be up here with us. Once again, we are humbly asking that if you're financially able to donate, that you please consider doing so. It costs a lot to keep our program up and running and free to all of you. So if you're someone who can afford to, or if you know someone else who can, please support those who cannot by donating to our organization so everyone can continue to get the education they deserve. Otherwise, we simply ask that you spread the word about pre-health shadowing to reach as many students as possible. Now, for the part you have all been waiting for, earning your digital certificate for the virtual shadowing hours from this session today. The first thing you're going to do is go onto our website and find our professionals course pages. In this case, Dr. Poojary's page. There, you will be able to take our quick 10-question multiple choice quiz based on the content from this session today. You will have 30 minutes to finish the quiz and earn a 70% or higher to get your certificate. We do know, of course, that sometimes technology can be difficult. And for this reason, we allow up to 2 attempts to take the assessment. But if you run into any difficulties, please do not hesitate to contact us. To ensure that our website does not crash from a high influx of students, we recommend waiting about 30 minutes to an hour after the session to take the quiz, which will be open, and I want to highlight indefinitely. And finally, once you have passed, you can click the Finish Course button at the bottom of the professionals page, and there you can download your certificate verifying your virtual shadowing hours. If, unfortunately, you missed a part of this session, or you want to go back and view other sessions to earn more certificates with verified virtual shadowing hours, you can go to our YouTube channel and watch our previous recordings. You can also find the VIA professional pages on our website and take the post-shadowing assessments for these as well. Be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming sessions and events. We are currently booked every weekday for the rest of June for virtual shadowing sessions, so we definitely hope to see you guys over there. Once again, thank you all for joining us today, and please do stick around if you have any questions, and myself and other team members will be happy to answer them. This shadowing session is officially over, and I invite you all to log off. Have a wonderful day, evening, or night, depending on where you are. And once again, thank you so much, Dr. Poojary, for joining us today.